Welcome to PCDC's presentation on strategies for opt-out screening. My name is Sarah Blust. I am the HIP and Healthcare Project Director here at PCDC, and we welcome you to this webinar, a shorter version of your average webinar on opt-out screening for HIV. So before we get going on our main presentation, just want to take a few minutes to talk about who PCDC is. PCDC is the Primary Care Development Corporation. We were founded in 1993, and PCDC is a nonprofit organization dedicated to expanding and transforming primary care in underserved communities to improve health outcomes, lower health costs, and reduce disparities. We got our start as a community development financial institution, or CDFI, as a way of supporting health providers in neighborhoods that were serving underserved patient populations to build better clinical services and clinical infrastructure, physical infrastructure. So PCDC we do provide loans, low-cost loans, to community health providers across the country. And through that work, we expanded into two additional programs, performance improvement and policy and advocacy. Our offices are in New York City and Los Angeles County, but again, we do work across the country in these three areas. HIP and Healthcare is our new program at PCDC. We are funded by the U.S. Centers for Disease Control and Prevention. So we thank the CDC for their funding, and we thank them for the opportunity to present to you all today on opt-out screening. And CDC is currently funding PCDC to provide free HIV prevention capacity building assistance services to healthcare organizations across the country. And the purpose of our program is to really strengthen the capacity of the HIV prevention workforce to plan, implement, and sustain high-impact HIV prevention interventions and strategies, and really fight the HIV epidemic, which really means reducing HIV-related morbidity, mortality, and health disparities across the United States and its territories. And so what we do is we provide, again, free training and technical assistance to healthcare organizations across the country who are looking to build their high-impact prevention strategies. And those strategies cover three main component areas, which are HIV testing, prevention with positives, and prevention with high-risk negative persons. And, of course, our presentation today is going to focus on the first component, which is HIV testing. And just a word about PCDC's background. We have done a lot of patient-centered medical home work in our past. We work with health providers across the country to develop and implement, high-quality systems around chronic care management. So we bring all of that to this work of HIV prevention and trying to build HIV prevention into routine clinical care. So moving on, we'll begin our presentation. And opt-out screening, in a minute, we're going to get into what opt-out screening is. But just to say that since 2006, the Centers for Disease Control and Prevention, CDC, have recommended that healthcare staff across the country adopt an opt-out HIV screening approach for patients ages 13 to 64. So that's been a while, since 2006. This has really been a policy and an approach that's really been recommended for quite some time. And this is something that we are definitely trying to support as capacity building assistance providers across the country. And then in April 2013, the U.S. Preventive Services Task Force, or USPSTF, updated its 2005 recommendations to better align with these 2006 CDC recommendations. And these recommendations have two main components. One is that clinicians are really being encouraged to screen adolescents and adults ages 15 to 65 for HIV infection. Younger adolescents and older adults who are at increased risk should also be screened. The other main recommendation is around pregnant women, and the USPSTF recommends that clinicians screen all pregnant women for HIV, including those who present in labor, who are untested, and whose HIV status is unknown. And as you can see, both of these recommendations have what's called a grade A recommendation, which is the highest recommendation possible from USPSTF. And what this means is that they are very, very confident that if you follow these recommendations, you will have a substantial health impact or a positive health impact on your patients. So they really are seeing that these types of services are very, very important, and they really should be followed out by all of us across the country. And what's also interesting to note is that these recommendations are what insurance providers pay attention to. So you have an easier time of getting reimbursed for grade A recommended services from the U.S. Preventative Services Task Force. And so in summary, the recommendations indicates a high level of certainty that this preventive service has substantial net benefit, and additionally may alleviate financial barriers to HIV testing for health centers and their patients. So if you are struggling to get reimbursed from your health providers on HIV testing, you should know that these recommendations really give you a lot of ammunition to negotiate better contracts around getting reimbursed on a regular basis for the routine screening that you do for your patients. And so what we have now is two sets of recommendations that are very closely aligned for the implementation of routine HIV testing in healthcare settings. And probably you did notice that there's a slight age difference between the CDC and USPSTF recommendations. One does recommend that you screen a little bit earlier, a little bit younger. And so in terms of insurance reimbursement, it's important for you to also double check with your provider as to what age range they actually will reimburse you for. So studies show that more patients consent to HIV screening when it is offered to everyone equally as part of routine care. And there are many studies that talk about this and talk about the success of this type of approach. And one of them is listed right here, which was kind of a formative study in 2005. And so, just to be clear that we're all on the same page, let's go ahead and define what we think of as routine opt-out screening. So routine opt-out HIV screening means that healthcare staff should inform their patients that they will be tested for HIV as part of their routine visit and give them the option of refusing or opting out of being tested. So the words inform are very key here. This is not a question. This is not something that you offer, but this is an expectation that patients will be tested as part of all of the clinical services that you will be offering them at their visit that day. And so health professionals should include informed HIV testing as they do with cholesterol, blood sugar, and other standard health screens in a patient's examination. And usually when you are doing opt-out screening, this also means that there's no required separate written consent. This, again, is very state by state, and you'll hear me saying this quite a bit through this presentation, that every state has its own way of operating when it comes to HIV testing, just like everything else. But in general, when opt-out screening is done, this means that this is really a verbal type of an approach. There's no need for a patient to sign a consent form. And this also means that the risk assessment that we used to do and the extensive counseling that used to be a part of HIV testing are neither required nor recommended. And the reason for this is that while these things are all have their strengths and were often seen as very important to having a patient be fully informed of their rights and all the information they need to have to get tested, these were also barriers to getting tested, that we were putting HIV in a different box or a different category as compared to other routine tests. And so the fact that we don't have a separate written consent form that's required, the counseling is a lot less. These are all ways that healthcare is really trying to remove any kind of barriers to someone getting tested as part of a routine visit. So what is not opt-out screening? Just to be clear, what it is and what it is not. So opt-out screening is not a secret. It's not testing without telling patients. That's very important. So even though it's an expectation, even though it's clear that they will get tested that day as part of routine care, they should still know that it's happening. So communicating that either verbally or through some kind of written information is very important. This is something that they really should be able to opt out of if they want to. So it's not a secret. It's not testing without telling patients. And it certainly is not mandatory. Again, they can opt out. We recommend that they get tested, that we strongly encourage people to get tested, but it is certainly not mandatory. And then the key here, again, is to not ask the patient if they want to get testing. It's not about offering the HIV test so that they have there's an expectation that they can, kind of say no necessarily. It's more of an expectation, and so the way to frame it is that this is really going to be done as part of your standard care. So if you do not already do opt-out screening, there are a couple of steps to consider when implementing this approach into your practice. And the first step that we would suggest is to kind of come up with your own way of presenting the opt-out approach to your patients. Kind of develop your own style for how you address opt-out screening, how you address opt-out testing with your patients, so that when you do talk about it, it's natural and it's really part of the rest of the services that you're offering. So here's one suggested script for an opt-out approach. As part of routine care, we test everyone for HIV unless they refuse, just like we test cholesterol, blood sugar levels, and other serious or common conditions. So you're really trying to just kind of put HIV in this kind of, framework of, we're going to screen you today because we screen you for lots of things, but you do have an option of refusing if you so choose. But again, this is a stylistic thing, and we recommend that people kind of come up with their own way of really presenting this information to their patients. Now, your health center, if we have some administrative folks on the phone, or we've got, we've got health center admin staff who are listening to this presentation, health centers can also help and support, the direct service staff by normalizing opt-out screening in other ways, such as posting signs, stating that all patients will be tested for HIV unless they refuse. You can also add language to the general consent form for treatment on your opt-out screening policy. So there's ways, kind of cues, that you can provide throughout your clinic, in your consent forms, and in your kind of posters and pamphlets around the clinic, that let your patients know that HIV screening is standard practice. And so that will help your staff kind of also normalize the idea that HIV testing is part of standard practice. And so it won't be a news flash to the patient that they're getting tested. They will already have been prepped that this is what's happening today. So step 2, determining what type of HIV test is best for your practice is really important. Probably, most folks are already using certain kinds of HIV tests, are already doing HIV testing as part of standard care, but there's a lot of new testing technology out there. There are new recommendations from CDC on the types of tests that should be used and in what order, and we're happy to share those guidelines with you. So this is actually a really good opportunity at this moment in time to take a step back and look at the type of testing technology that you used and think about how this relates to your opt-out screening type of approach and figure out what is the most appropriate test for your practice. And then that will help you understand who is actually going to conduct the opt-out screening, who needs to be trained up, who really needs to know how to do it, and how. And, most providers, in our experience, we, do HIV testing either by adding the test to a blood that's already being drawn, or by performing screenings using rapid test technology. But again, you need to implement the best testing methodology for your practice, and it can be kind of a combination of bloods and rapids and other kinds of technology to kind of work this into a workflow that is best for your practice. Step 3 is to determine what kind of documentation is needed. So if you don't document it, it didn't happen. So knowing what documentation is required is very important for a good HIV screening program. And again, this varies state by state. So this is a really fabulous resource from UCSF. They keep a state-by-state guide on HIV screening laws. And so you can just easily click to this website and click on your state and get a snapshot of what is asked for or required or recommended by your local Department of Health in terms of HIV screening and documentation. And you know, if your state Department of Health is recommending opt-out screening, it is very likely that no signed patient consent form is required, which means that once you have informed your patient of your intention to perform the test, you can go ahead and proceed with the screening unless they have opted out or declined. Now, there are things that are required in terms of HIV testing, and there are things that are recommended. So this is a practice that we actually recommend if you are really looking at your whole HIV screening program, how you're doing your HIV screening. If you have the opportunity to build this into your EHR or EMR, we would suggest that you track the reasons for a patient possibly refusing for an HIV test. So, you know, you're going to be screening everyone, as it's the intention of an opt-out screening program. So it's very possible, it's very likely that you will have people opting out. Now, if you're not tracking why people are opting out, then it's very hard to know if there's any quality improvement that's necessary, or, you know, maybe there are certain staff that aren't doing the opt-out screening approach the way that you would prefer. You know, so kind of knowing how this refusal process is working and why will really help you kind of go back and look at your data to know that you are, you know, really offering this in the best way possible. So this is something that we would recommend, obviously not mandatory, but it's really helpful for QI. Step 4 is knowing how to bill for HIV testing. Obviously, it's very important to know how to get reimbursed for these types of services. So, you know, this will greatly impact your ability to implement a new opt-out screening protocol. Getting paid is important. So, you know, again, ways to maximize reimbursement for testing can often vary because of state policy and clinical setting. So, you know, I talked a bit at the beginning of this presentation about how PCDC works across the country as a capacity building assistance provider. And we do support health centers to maximize reimbursement around HIV testing. So if this is an area that you would like more information about, we will have our contact information for you at the end of the presentation. And we definitely work with centers one-on-one to figure out what are the codes, what are the ways they should bill, what are the ways they can possibly negotiate contracts with their insurance payers to get reimbursed appropriately. Now, the AMA and AAHIVM have also summarized clinical billing codes into a helpful guide, and this guide actually is really great. It is short, but it also has patient scenarios, which is really good, I think, for someone who is a provider or working in a healthcare setting. It provides you with a few different patient scenarios, so you can see kind of, you know, for certain kinds of patient complaints or patient profiles, you can see what codes would be the most appropriate to use for reimbursement. And so that's a great link. I highly recommend that you check that out and print out that resource and have it and give it to your coding and billing staff if they don't have it already. Now, the last step we'd recommend is to develop your linkage to care strategy. You know, obviously, it's not very ethical to screen all of your patients for HIV if you don't have a good system in place for linking them to care if you have a reactive or confirmatory positive result. So this is a step you have to think, forward about and think ahead about. And so we would definitely encourage you to have, think through all the steps that you would want to take if you do have a reactive or confirmatory positive. Now, for community health centers or hospitals or clinical settings that have HIV specialists, the linkage to care process will probably be somewhat easier for you. But sometimes there is the need for QI even in those situations. For other settings, when you're referring out, obviously you're going to have to do a little bit more work to make sure that your patients really get into care. So you think about, who is that person you're referring to? Do you have a relationship with them? Is there a feedback loop on whether or not the patient actually makes it to that appointment? And what's really helpful in that regard is to have one staff person to follow up on all appointments for HIV-positive patients to address any issues and ensure appointments are kept. So often in many health centers or clinical settings, we see care managers, we see patient navigators, we see care coordinators being assigned to coordinate and manage this piece. And those folks have a good idea of whether or not their patients make it to the provider for their HIV treatment. And we encourage you to do the same. So that's about, so now we've gone over what is opt-out screening, what are some of the ways you should implement or could implement an opt-out screening program. Just want to take a few moments to offer some suggestions on how to work with patients who opt out of HIV tests, because that's I think, something that happens quite a bit. And it's, just as you would have your script for presenting the test and informing people of the test, you should have your script for the patients who opt out of an HIV test, because there's opportunities potentially for either education here, or there's opportunities to address other concerns that the patient might have around HIV testing, and therefore, possibly increase the chances that they will get tested in the future. So these are some of the main reasons that we know of as to why a patient might opt out of HIV testing. We've heard this quite a bit from other providers we've worked with. So number one, just got tested. Number two, doesn't feel at risk. This isn't really something that applies to them. And potentially the people who don't really feel at risk may also even be offended that you are talking about HIV to begin with. Number three, people are worried about what the result would be. So they're actually, they think they may have engaged in some kind of risk behavior, and they're concerned that maybe this result actually would be positive or reactive. And then finally, we do hear about the confidentiality concerns, that people are worried that others will find out, A, that they actually just got tested, because there can be some stigma around getting tested for HIV, or then, of course, people will find out if they had a positive result. So this is, a concern for people who are definitely in small towns, rural communities, or certain kinds of health centers where everyone knows each other. So, this can be a barrier for people to get tested. Now, this is one possible approach that we would suggest for, one possible script for your patients who were just tested, because it's still an opportunity for some education. So I'm really glad to hear that you've been tested recently for HIV. That's a really good move. Getting tested today would also be a good move if you had any concerns about the window period for HIV testing. Do you have any questions about the window period? So, it would be pretty easy to move on from patients that say, oh, no, don't worry about it, I just got tested. I don't want to get tested today. But, I think it is an opportunity to probe about the window period. I think this is still some kind of source of confusion for some folks about, when your results from your HIV test are really going to be the most accurate. And so exploring that with your patient, talking about any possible risk behavior in the past 3 months is going to be a useful thing to do for those patients who were just tested, even though, again, very important to affirm that they're doing the right thing and that was really a great thing that they've done. So another patient that we've talked about is the patient who doesn't feel that they're at risk for HIV. And then, again, like might even be offended that you're talking about this to begin with. So for this patient, normalization is the key. So here's a possible script, which is, we test patients for all kinds of things they probably don't have. Most patients don't have high blood pressure, for example, but we test everyone for high blood pressure. But HIV is common enough in our community that we have made a decision to test everyone as a health precaution. And the earlier people know they have it, the better off they are, because we can fight it. It does no one good to have HIV and not know about it. So you'll see that there is an asterisk up there, which is that, in some, depending on where you're located, you may be in an area where there actually is a high incidence or prevalence of HIV. And so, there's even more of there's an even stronger rationale that you can bring into this discussion about why it's really important that everyone is tested for HIV, because it's a community problem, it's a community issue. So that's just something to note, that you can kind of bring that in based on where you're located and the kinds of health issues that you're experiencing in your particular community. Other possible scripts for patients who don't perceive themselves to be at risk. 1 in 4 people with HIV do not even know they have HIV, and this means they could be putting themselves and their loved ones at risk. Many people with HIV have no signs of illness. They feel just fine. And, if it really just it's not kind of going in the direction of testing, you could always say, you know what, if you don't want to get tested today, just know you can always get tested here in the future. So we're not forcing the HIV test on anybody. We want to make sure that they just know that it's available, that it's recommended, and that your door is open should they change their mind in the future. For the patients who are anxious, I always think it's good to focus on the treatment and the success of treatment and how things really look different for HIV, for folks living with HIV than it did, 10 years ago. So you can say something like this. Treatment for HIV has come a long way. People who stay on treatment for HIV can get to a point where the virus is undetectable and there's a really low chance of infecting somebody else. People with HIV are living long and healthy lives. The sooner people know about it and the sooner they get treatment, the healthier they are. So really trying to emphasize that there is just a huge amount of success these days around treatment for HIV. The life expectancy is hardly different between people who have HIV and don't have HIV if they're on their meds. That people have, things they have to take care of, but they can have long and healthy lives. And I think that information, that education piece is super important and still really hasn't trickled to the general discourse about HIV. So the more we can kind of educate on the success of treatment, the better. And then finally, some patients might refuse to get tested because of fears around lack of confidentiality. So I was mentioning this before, that this is a concern for patients in small communities where everyone knows each other, rural areas, etc. So some possible scripts for these patients are the following. To emphasize that we take your privacy and patient confidentiality seriously here. What happens at the center stays at the center. We know this is a small community, and we want you to know that we will never discuss your care outside of our facility or in front of other patients. And then finally, this is one that I think I like the best because it's more of an open question that lets the patient talk to you about what their specific concerns are. Let me know what I can do to make you feel more comfortable about getting tested here. So what is really going on with you? What can I do to really address your specific concerns about confidentiality? So in conclusion, just wanted to kind of, hone in on these 3 points. Opt-out screening is an approach that has been around for a while, and it's been recommended since 2006 by CDC in order to increase testing and identify HIV-positive patients faster. And there's a lot of good evidence behind it, and it's really seen as, a best practice approach to screening. The U.S. Preventive Services Task Force categorizes routine HIV testing as grade A, which means that it will have a substantial health benefit for your patients and will also be paid for by most insurance providers, also very important. And then finally, opt-out screening is a relatively simple approach, but it has some key issues that need to be addressed for it to be done well and successful. It is relatively simple, but I do think that it is something that needs to be practiced, and there are ways that you can make this more effective if everyone works together at your center, if there's messages that reinforce each other, and if you are kind of incorporating this into your QI efforts overall. I want to share some additional resources for you. Your local state health department is always going to be the go-to source for information on what is required around HIV testing, what is recommended around HIV testing, and also your state departments of health or your local departments of health often have additional grants or funding for HIV testing, such as test kits, and so it's possible to have them help you move forward in testing technology as well. Your State Primary Care Association, or PCA, is always a good resource, and they have, definitely, HIV testing resources and information they can share with you. Of course, the CDC, of course, HRSA, or the Health Resources and Services Administration. This particular link will send you right to a policy piece on how to respond to the U.S. Preventive Task Force Services Guidelines. So this is a very useful link to check out. And then finally, NAC, or the National Association of Community Health Centers, has a lot of great tools, toolkits, resources on HIV testing, specifically implementing opt-out screening. And so that link will take you right to that page as well. And so for more information about our services, this is our contact information. This is our phone number and our email address. Again, PCDC works nationally with healthcare organizations across the country, and we can work with you one-on-one to train your staff up in opt-out screening, to develop a QI system around opt-out screening or HIV testing, to look at third-party billing opportunities or revenue maximization opportunities for HIV testing. So any of the pieces that are state-specific, we are very willing and able to help you, and that's our information right there. Thank you so much, and thank you for your time. Again, this is my contact information if you want to reach me directly, and we hope this has been a useful presentation for you.